effective study.
Last chapter, it's on diseases of the urinary and the reproductive system. So just a little review, probably to your anatomy. The urinary system regulates the chemical composition and volume of the blood. It excretes nitrogenous waste products and water. And it is also prone to infection because it is open to the external environment. And so bacteria easily can get in there, and the mucous membrane is a good growth media for bacteria once it gets inside. So the urinary tract consists of a bladder, one urethra. The urine leaves the bladder through the urethra, 2 kidneys, and then there's a little undertone of somebody talking. And from those kidneys, each of them have a ureter that takes the urine from the kidney and into the bladder. And so these waste products that get removed from the blood is called urine, and it moves through and it's taken out of the blood as the blood moves through the kidney, and then excreted from your body in urine. And you need to know kind of this structure and function of the urinary tract. So anything I remember, I will tell you, and there's pictures in your book also. So the urine moves through the ureters into the bladder, and it exits the body through the urethra. The male urethra also transports the seminal fluid. So you have blood going through your kidneys, and there's certain waste products in the blood that get filtered out as urine, and it's going to move from the kidneys through the ureters into the bladder, and then leave the bladder through the urethra. So there's a little picture, similar picture in your book that you can look at. See the kidney on each side with the little tube coming down to the bladder. Those are ureters, and then the urethra leaving the bladder. So anywhere that along that tract that you would have an infection, then they're called urinary tract infections, or UTIs. And they are the second most common type of bacterial infection in humans. And the first would be, for bacterial now we're talking, is respiratory infection, such as pneumonia. So normal microbiota of the urinary tract, the kidneys, the ureters, the bladder, and the upper urethra should be sterile. And they're kept sterile by this flow of urine that's going through. And normal urine is on the acidic side and has antimicrobial properties. Because we know that bacteria don't like the acidic side. It's the fungi that like that. Bacteria likes to grow somewhere around neutral. And we do have some normal microbiota that you would find in the outer urethra, and these are some of them that you would find, non-hemolytic streptococci, that you don't have to copy with them. Staphylococcus, Corynebacterium, lactobacillus, of course we know that the female body especially has lactobacillus, micrococcus, one of your unknowns, Neisseria, and Bacteroides. So the urine is produced in the kidneys, gets stored in the bladder, and it is normally sterile. But microbes can be introduced into the bladder, and then it will cause an infection. So active infection of the urinary tract can usually be caused by one of three basic ways. One is a descending infection from the kidney. The bacteria are deposited into the kidney from the bloodstream, and then they are shed and descend via the ureters into the bladder. Or you can have an ascending infection to the kidney. You have an infection in your bladder, and then if it isn't treated, it can ascend up in through the ureters to infect the kidneys and cause polynephritis. And then you can get an infection from the urethra to the bladder. And one way you can get this is through mechanical type devices, like if you have to be catheterized. That's one of the nosocomial ways that you get bladder infections in the hospital. And women have a short urethra compared to a man, and it's very close to the anus, and that sometimes allows the bacteria from your colon, from your GI tract, to get into the bladder. Cystitis means common inflammation of the urinary bladder. And the most common pathogen is E. coli that does that. You have E. coli in your colon. And you know it's a gram-negative rod. So symptoms, if you have the bladder infection, is dysuria. That means it's difficult and painful to urinate. And you may have pyuria, which is pus in the urine, and a fever and nausea may go along with that. E. coli has some virulence factors to help it cause infection, and one of those is that E. coli has adhesions that are on the ends of the fimbriae. Remember, the bacterial cell has these long projections all around the cell, and those are called fimbriae, and those are for the purpose of attaching the bacteria to something. In this case, it attaches the bacteria to the epithelial lining of the urinary tract. So prevention would be to empty your bladder frequently and to practice sanitary practices. So one way would be when you are wiping yourself, you're wiping from front to back. You have to be careful. Treatment for bladder infection is antibiotics, and then they can give you, I can't remember the name of the medicine, but to take away that horrible pain that goes along with it. You know, the one that when you have to go to the bathroom.
It turns red and stains it.
That one.
Pyridium.
Yes, that's it. Polynephritis is inflammation of one or both kidneys. This one is also usually caused by E. coli. So if you have a bladder infection, which we're calling cystitis, it could, and you don't treat it right away, it could ascend up to the kidneys and cause pyelonephritis. And then that can lead to bacteremia, meaning that the bacteria now, the blood filters through the kidneys, so now that bacteria is going to be spread, you know, in the blood through your body. Symptoms of polynephritis are fever, flank pain, and back pain. And if the disease becomes chronic, you can get scar tissue forming in the kidney, and then it can lead to kidney dysfunction. It can be life-threatening, so usually the treatment would begin with IV antibiotics. This is just a little recap here, putting it all together. For urinary tract infection. Excuse me, urinary tract infections can involve any portion of the urinary tract. Cystitis is a common bladder, what we call a bladder infection, and E. coli is the most common cause of that bladder infection. Urethritis is inflammation of the urethra, and there's many organisms that can cause that. And then polynephritis is the kidney infection, and again, E. coli is the most common cause, because it usually, if you have a bladder infection, which is caused by E. coli, and it ascends up into the kidney. Leptospirosis. The pathogen is a spirochete, so that is a type of bacteria. It's that little spirally one, just like syphilis, that's a spirochete as well. Leptospirosis is caused by Leptospira interrogans. The infection is zoonotic, that means that it's coming from animals, associated with animals, both wild and domesticated animals. The mode of transmission, or the vehicle, is urine or urine-contaminated water that comes from an animal urine that is infected with this bacteria urinating in the water. It enters the host through the mucous membranes of the eyes, nose, or through skin abrasion. It also can be ingested and then go through the oral route. Acute symptoms are headache, muscle ache, chills, fever. And you have that for a few days, and the symptoms disappear. And then you get a second episode of fever. The bacteria can spread to organs and invade the immune system. And in a small number of cases, the kidney and liver also become infected. In that case, it's called Weil's disease. So Weil's disease is a cluster of symptoms caused by this invasion of the bacteria to the kidney or the liver. And you get jaundice, anemia, and neurological symptoms as well. Now they have an emerging form of this leptospirosis. It's called pulmonary hemorrhagic syndrome, and it causes massive bleeding in the lungs, and it has a fatality rate of greater than 50%. So this is an emerging disease. And if you go on the CDC's website, they have this leptospirosis on their disease. Diagnosis is made by serological tests or testing fluids for the organism or its DNA. Treatment is doxycycline. And in the United States, dogs and rats are the most common